So we've talked about Morpheus and why Morpheus is a pretty cool thing, because not only can it reduce some fat, but it has a tightening effect. By the way, one thing I didn't mention is that our protocol, as well as really the protocol everywhere I know it, is to do this 3 times, 6 weeks apart, to get the best tightening possible. But now let's say you're looking at a face where there's really more than a little bit of fat in the jowls and more than a little bit of fat around, under the jawline, under the neck area. So when we combine Morpheus with lipo, and usually adding something called facetite, that is an even more powerful procedure for people simply that have more fat. In other words, Morpheus reduces fat, but it does it very, very modestly, very, very bit by bit. And if you want to get a more solid result, especially if you have a significant amount of fat, and again, it's about a specialist helping you understand what we call significant, what we call a little, and that's what we're good at, because we have so much experience with this technology. It's giving you the advice, do you need the bigger procedure, which again isn't a big procedure at all. So, and it's actually an easier procedure to undergo. So if you're doing Morpheus combined with lipo and combined with facetite, it all works together very well, because the injection for the lipo numbs you for the Morpheus, and the facetite is really an ancillary part of the lipo because you need it, because we want to tighten the deeper tissues and not just right under the skin with the Morpheus. So facetite's a similar radiofrequency technology that just goes about it differently. So this combo is still done in less than an hour. The only thing in the recovery is that you're more likely to have a little bit of bruising, although I honestly am amazed how so frequently this area bruises so minimally, but we can't guarantee it. And activity-wise, you're back to activities quickly. So that's the Morpheus leading into the trifecta.
Okay.